It's interesting when you take a case like you see here in front of you, it's going to require a variety of burrs. I don't care if it's a carbide, a diamond, a slow speed round burr, an endodontic access burr. There are a wide variety of burrs that we need to understand what they do, their shape, their purpose, and how they can create a final result like you see here. All these burrs are classified by their design, obviously, their shape, diameter, the grit. They're also measured in millimeters. Normally, a cutting burr will have 6, 8, or even perhaps 10 blades. And often finishing burrs, like you see exactly there in the center, which is the gold burr there, the carbide, will have 12, actually up to 40 blades of cutting. So it's an interesting process there. That spiral design carbide burr is perfect to create a very nice smooth surface. Then when you move over to the right where the diamond burrs are, again, they have a different intention of what they're meant to do and perform, and how they're able to remove and reduce tooth structure. And of course, the banding on the diamond burrs indicate their grit, how coarse they are, and what their level of tooth reduction can be. That what you need to come to learn is that the actual cutting of the carbide burr takes place at the edge of the burr. And the burr head is going to consist of uniformly, as you can see here, spaced blades that have kind of a concave area between them. The blades are really a projection of the burr head that will create that cutting edge of the burr. And each blade has two sides. There's a rake side, and then there's going to be a blade side. And so a blade face. So you're going to have an area that's going to have a clearing and a cutting. So one's going to be a leading edge and the other is going to be like a trailing edge. Diamond burrs, they're totally designed to remove gross tooth structure. You want to have a burr selection with your diamonds that's really going to expose as much diamond possibilities as available, because 20% greater exposure means you're going to have a 20% greater cutting ability, bottom line. So you're going to have crisper margins. You're going to have a better blend of your covering and your tooth reduction. One of the things I've learned over my career, it's so critical to make sure that you have proper moisture and hydration while you are prepping any indirect restoration. And really, if you want to maximize the cutting ability of your burr, you do turn the water up. It's very, very important. None of the methods that they used, and they're using a variety here of sterilization methods, okay, were found to be absolutely efficacious in the decontamination of a dental burr. So this, again, further supports why do we even try to reuse a burr? It's not going to be able to be effectively decontaminated. And there's debris there along with other bacteria, perhaps viruses. And I want to share some clinical applications of what burrs I use for what procedures and what preparations. And I've just found these to be extremely useful over my career over time. So for a composite, for a virgin tooth, I love the 330 burr. This is the neo burr here, a carbide. It's important to have choices that you make within your practice, certain burrs that are going to create what that lab needs to create a proper restoration. So it starts with that preparation. And we know that ceramics have to have rounded preparations and good marginality. So here's a great sampling of what I choose. I personally use 4 burrs. I'm not saying you need to use 4, but I just do. This is how I use them. I'm going to step you through how I go about when I'm doing these type of preparations, just so that you can kind of understand this. I always kind of use this adage, and I take this away from my father, who I've worked with over a time period. But bottom line, he's always said, Lori, measure twice and cut once. And it's so true in dentistry. It's so true in carpentry if you build or work with your hands. But the takeaway is you've got to have the proper, again, reduction. And many labs will tell you they don't see the proper reduction. The beautiful thing about digital dentistry, obviously, or doing scanning, you have that immediate feedback from that screen or that occlusogram that can tell you exactly how much reduction you have. So that's a beautiful thing to have happen. So very important. But for, again, just a rehash, with zirconia reduction, you've got to have that 1.5 millimeter or 2 millimeter occlusal reduction. So very important again. And the proper, again, tapers between the 5 and 15 degrees. What you're using to create a margin, that's like your signature. And we know right now, suitable for all ceramic restorations, it's going to be a round end taper. You can see exactly my go-to for that. You can also use a modified flat end, which I absolutely love. That's probably my favorite. It really creates beautifully rounded edges and no transitions. When you're managing soft tissue, it's really important to have not only that great margin, but you've got to have the ability to see below that, especially when you're doing any types of scans, and you've got to have clarity there. So make sure you have a good defined margin. You're able to see 0.5 millimeters apically underneath that margin. That visibility is real there, because that's going to give you a proper read for your scanner. Another tip to take away is create smooth preparations. And often when I finish, I'll use a very fine or super fine diamond. I also like to use a Dura white stone.